I would like to invite Čemažar from Institute of Oncology, Ljubljana. We can see you.
Hello?
Yes, we can also hear you. Please.
Yeah. Hello. Hello, everybody, also from my side. I'm Čemažar. I'm coming from the Institute of Oncology, and I will present the work that was done in collaboration with Professor Tozon from the University of Ljubljana, Faculty of Veterinary Medicine. So I would like to present the clinical study that was published in 2017 and was selected as an excellent achievement recognized by Slovenian Research Agency. So what we have done in this clinical study is that we combined two different therapies that use the same delivery method, that is electroporation. And combining these two therapies, one is elektrokemoterapi, that is already a standard therapy, not only in veterinary medicine, but also in human medicine, and is included in the European and several national guidelines for the treatment of subcutaneous tumors, and is currently used in around 160 centers, oncological centers around Europe. So what do we do? Electrochemotherapy is actually one of the local ablative therapies where we combine chemotherapy that is injected either intravenously or intratumorally, as you can see here in the screen. And after that, electric pulses are applied that make the cell membrane more permeable. Thus, the chemotherapeutic can enter the cells and kill these tumor cells. But as I said, this is a local therapy without a systemic effect. And to make this therapy a systemic also therapy, we added another component, a component of gene therapy, immunogene therapy. So we added a plasmid that is encoding a cytokine interleukin 12, which is a cytokine that is able to stimulate immune cells and actually activates both arms of adaptive immune system, so cytotoxic arm and also the memory. And if we actually inject also the plasmid by using the same electroporation parameter, we can also transfect the cells, and these transfected cells, this is mainly stromal cells that are also present in tumor microenvironment. They then secrete the transgene. In our case, this is interleukin 12, which can go around the body and act on a distant potential metastasis. So how is it done? This was a study on a spontaneous tumors in a patient. This was in a client on dogs. So first, the dogs are anesthetized, prepared, then the application of drug and plasmid DNA goes directly into the tumor. This is how the application of electric pulses go. We can use either needle electrodes or the plate electrodes. The number of applied pulses is low, is 8, and all the procedure is then actually finished in a couple of minutes. Then the dogs are checked up for regular evaluation and the treatment is evaluated. Can we go to the next slide? This is just the two examples to show you how the effect is good. So before therapy and then after several weeks or months, there is a formation of thick crust that falls off, and we can achieve really nice cosmetic effects. And this is also a very, very long-lasting effect. And when we compare the results of our study with available literature data, we actually looked and see that our median survival time is much, much longer than after surgery or other treatment modalities for this particular tumor. So now we are in the preparation of first-in-human study for gene therapy, and we hope that we will be able to start next year on a head and neck tumors in human patients. Thank you.
Okay, thank you for the nice presentation. Do we have any questions? We have a question by Robert Primk. please.
Hello, I think now you can hear me. I have a question. How many times does this treatment needs to be repeated so that it's successful?
The thing is that the repetition of treatments actually depends on the size of the tumor. If the tumors are smaller, let's say there's a cutoff, I would say 2 centimeters, then usually it's actually one-time treatment. And with these treatments of tumor that was smaller than 2 centimeters, we actually achieved 100% of complete responses. But if there are bigger tumors, we usually repeat in 4 weeks interval. And it can be up to 4 or 5 times if necessary.
Maybe we have time for another question. How do the docs take this treatment? Are they fine, or is it quite stressful for them?
The thing is that in human medicine, we can use like local sedation or something else, but spinal block or something. But in dogs, they're always anesthetized, because just the injection and manipulation of dogs depends on the dogs. But they're anesthetized, it's short anesthesia. All the procedure is maybe with the preparation of dog takes half an hour. So, but after a while, we measure the systemic side effects. There are no systemic side effects because the chemotherapeutic drug dose is very low because of this potentiation by electric pulses. And all we have is maybe just this local, as I show you on the picture, like local edema or maybe some infiltration and formation of crust, but no systemic side effects.
Okay, thank you for the presentation.